May dagdag na paraan laban sa COVID-19. Together, we can be the Solusyon Plus. Bida Plus sa maayos na daloy ng hangin. Bida Plus sa maikling pisikal na interaksyon. Bida Plus sa pagsuporta sa bakuna. Bida Plus sa mga kwento ng kaligtasan sa Bida Barangay. Sa dagdag na pag-iingat, maraming buhay ang maliligtas. Bida Solusyon Plus laban sa COVID-19.
Of all the tough decisions you have to make today, your family's health doesn't have to be one of them. Not when you have the choice to go organic and live full, natural, and holistic lives. So start your day right. Load up on antioxidants. Choose only organic superfoods. And keep the momentum going. We're making it easy for you. Live organic, choose organic. It's easier than you think. Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Organic acai has very high levels of antioxidants and essential nutrients that help keep your immune system strong. Organic acai premium blend and freeze-dried capsules daily to help increase your resistance against harmful viruses. Keep yourself and your family healthy and protected with Organique.
Mahalagang paalala, ang Organic Acai Premium Blended Freeze-Dried Capsule ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Previously on Wellness Wednesdays.
At nahihirapan din talaga po sa finances. So, as the children they do is that nag-form sila ng group chat. No? So, doon naglalabas ng mga naglalabas ng
Wellness Wednesdays with Organique. We care because you matter.
Hi, good afternoon, and welcome to Wellness Wednesday. So this week's Wellness Wednesday is about UTI. Alam mo ba how common UTI is across the board? So we've actually already had one episode discussing UTI, but because it's a very, very common disease that everyone really suffers, or not everyone really suffers, but a lot of people we know suffer. We wanted to just remind you guys of that and then bring in some new perspective. So before we dive into today's topic, actually, we have our game. So yung game natin this week is not anymore a guessing game like the past weeks. The game today is to count actually the number of organic acai berry freeze-dried capsules in this photo. So you can check us out here on our Facebook page at Organique Inc. and then comment your answers in the post to get a chance to win one Organic Acai gift pack. So yung Organic Acai gift pack namin will actually contain the capsules that you are guessing. Yes, so you get one free pack of Organic Acai capsules, and then you also get the choice of either Acai Choco or Acai Coffee. So good luck with today's game. And then again, going back to today's topic, UTI. So UTI, today here we have our wonderful guest speaker, the Dr. Mitch. So see, Dr. Michelle Dado is from FPOG. She is an obstetrician gynecologist, a digital thought leader, and the secretary of Quezon City Medical Society. Welcome back, Doc Mitch. It's been a while.
Hi, Luisa. How are you? It's been a while, but it's good to be back.
Yeah, we're glad to have you back. So,
Thank
Doc
you.
Mitch, since you are a obstetrician gynecologist, can you explain to us what is the need of why your profession in gynecology would be looking at UTIs?
Exactly. I think I most of the people now watching are wondering kung bakit OB ang guest, hindi urologist, diba? But you know what? Women kasi are more prone to are more prone to develop UTI because of our anatomy. Okay, so we have a shorter
Okay.
urethra. So we will explain that. We'll be talking about that, Luisa, as as the discussion progresses. Pero women are more prone to UTI. That's why it's one of our the topics that obstetrician gynecologists should really talk about.
Oh, okay. So before we dive into the topic, what is UTI exactly?
Okay, UTI is actually it's a very simple infection. It's a very common infection, as you've said. But it's an infection of your kidneys, your ureters, your bladder, and your urethra. So it's the whole urinary system. So it's an infection in any of the different parts of the urinary system.
Oh, okay. How do you know if you have UTI, Doc?
All right, there are a lot of actually different symptoms depending on where you have the infection, diba? If you have actually infection of your kidneys, okay, mamaya we'll be discussing it. In general, muna ganito, symptoms of UTI, if you have a burning feeling when you pee, diba yun yung laging sinasabi ng mga pasyente, Dok, init, umihi. So,
Mm-hmm.
there's, diba? So, mainit umihi, or you frequently go to the washroom kasi lagi ka naiihi. So, there's frequency. There's also what we call dribbling. So, very small amounts of urine. You feel like you want to urinate, pero pagdating mo sa banyo, konti lang ang lalabas. So, tapos meron din pwede, when you look at the color of your urine, kasi normal color of the urine is straw color or almost, parang like water. So that's the normal color of urine. Once you see your urine is dark yellow, it's cloudy, so hindi siya clear. Minsan pa, kung sobrang talagang advanced ang stage ng infection mo, you may have actually a tea-colored urine. So para kang may iced tea dun sa toilet bowl. Tapos, diba, yuck? And then, at least they can imagine it, diba? So, sometimes there are patients who have actually who have fever and chills together with their frequency and their painful urination, and then there's like pain in the pusan area or in the hypogastric area going to the lower back. So and there are even some patients who even experience nausea and vomiting. So ang dami, very very wide ang symptomatology ng UTI. So you have to have a very high index of suspicion talaga.
Okay. And does this cover all cases of UTI, Doc, or is this like some of the symptoms for some types of UTI? May ibang types ba yung UTI?
Okay, yeah, iba-ibang types ng UTI. Technically, may tatlo. Okay, what we term as pyelonephritis, cystitis, and urethritis. So, depending, sabi ko nga doon, sa different areas na may infection. So cystitis is the most common, which is infection of the mismong bladder. Usually when you have cystitis, it's more of, since ang bladder natin is in the puson area or in the hypogastric area, so you feel pressure there, you feel pain, so there may be like back pain, tapos you may have very frequent or painful urination, or you have small dribbling nga, yung very little amount of urine na lumalabas na madalas, tapos you may have blood in the urine. So that's very most common. Those are common signs of cystitis. The next type of UTI would be your urethritis. The urethritis is infection of urethra, or yung labasan ng wiwi. Okay, the urethra is near your vagina. Okay, and also near the what do you call this, the anus. Kaya nga very up sa anatomy ng babae, di ba, I told you earlier, OBGYNs also are concerned with UTI because of our anatomy. So the urethra is shorter, so there's lesser distance for the bacteria to travel to infect the whole urinary system, because it's pretty near the anus and vagina. So any infection in any of the three may actually make you have UTI. So when you have urethritis, it's more of masakit, burning sensation, mainit mihe, and then you may have some discharge, okay, there when you pee.
Right.
You may have some whitish yellowish discharge. And then the third type of UTI is, Luisa, the pyelonephritis, or infection of the kidneys in itself, yung kidneys mismo. Usually, ito yung may nagkaka-fever, nagkaka-chills, sometimes patients have nausea and vomiting, and then you have upper back pain kasi where the kidneys are. So, sa upper back there. So, may ribs, sa baba ng ribs. Yun yung mga patients may also experience dysuria or painful urination, pero mas common yung pain sa back pag umiihi. Yun, upper back, yeah. There.
So, Doc, so you're saying that yung symptoms talaga can be more common with certain types of UTI. For example, yung
Yes,
back pains, like you mentioned. Oh, okay. So when we experience this, parang we can already no what kind of UTI that we're getting or we have.
Exactly. Oh, exactly there.
Okay, Doc. So we have a question kanina that just showed on the screen. It's gone now. But they were asking, is UTI a serious illness? Or can it be serious illness?
Can be a serious illness if you don't get to treat it. Pwede kasing maging recurrent. Okay, how do we define recurrent UTI? When you have 2 or more bouts of infection in a 6-month period, or 4 or more bouts of infection in a 12-month period, so in a year. If you don't get to treat UTI or very recurrent siya, pwedeng develop ka ng kidney problem.
Wow.
Diba? Yeah. Yes, oo.
So it is it can be a serious disease.
Exactly. It can be a serious problem if you don't give attention to it. Tapos, what you can have permanent kidney damage. Pero that's in the parang and yung talaga sobrang hindi mo tinitreat, hindi mo siya napabayaan mo lang siya. Alam mo, UTI lang to. Tapos you self-medicate there, diba? So you self-medicate. So there, and then for pregnant women naman, here, this is obvious already. If you have frequent bouts of UTI, you may actually be prone to preterm labor, okay, or preterm birth. Yeah, it may also affect your baby na pwedeng mahawa si baby ng infection. So, yun, isa pang complication yun na it can be actually really bad. Another is very frequent UTI also can cause now changes in the anatomy of your urinary system that may actually lead to more frequent bouts of UTI. So worst case scenario, sepsis, Luisa. When infection is not treated and it's very high ang infection, and then it spreads to the blood na, although ito na yung mga talagang sabi ko nga, end of the spectrum already, but it can be a serious problem. Yeah.
Right. So, Doc Mitch, you mentioned pregnant women, no? And then I've known quite a bit of pregnant women who said that they experience UTI during pregnancy, And then you
Mm.
said also that women experience UTI more often. Are there certain groups na more at risk sa UTI compared sa iba?
Okay, yun nga, in general, women are more at risk because, again, of our
Mhm.
anatomy. And then because of the changes in our hormones, diba? Yung monthly cyclic changes natin of our hormones changes actually the level of our estrogen. So talking about estrogen, menopausal women because mas dry ang vagina, mas prone sila ngayon to infection, tas medyo hindi na rin ganun kaganda yung musculature ng bladder, and then because of the hormonal changes also, menopausal women are also prone to UTI. Third group is yung pregnant women because again there's also a change in the pH level of the vagina, and if there is like a change in the pH level of the vagina, you're more prone to infections. And then sabi ko nga, 'di ba, the vagina is very close to the urethra, and so if you have an infection in the vagina, pwede mahawa yung urethra with the infection. And then third, those women who are using certain types of contraceptives like diaphragms, or you use condoms frequently, and you use mga different kinds of gel, although it's not available naman here in the Philippines, yung mga spermicides. Those women who are using those kinds of contraception are actually more prone to UTI.
Oh.
Mm-mm.
So what about so what you're saying, Doc, is it really sounds like, women are the most at risk. How about like for men? Is there like a
Okay.
risk group for men?
Yeah. Ito here, as you see in this screen, diba? For men naman, it's more of, in general to, men, women, poor, what you call this, poor immune system. Okay? Pag hindi
Okay.
maganda ang immune system mo, kahit anong infection yan, mas madali kang tamaan. Okay? Poor hygiene, this goes for men and women also. Diba? If you don't clean yourself down there, if properly, of course, diba, you'll be more prone. Sexual intercourse can also be actually a risk factor for developing UTI, but it's really more for women more than the men. There's what we call honeymoon cystitis. Now, when they do it more frequently, there's irritation now in the bladder floor, which actually causes or triggers all these symptoms of UTI. Men and women who always self-medicate with antibiotics, diba? Lalo na in this time of pandemic, may konting sipon ka lang, ay, antibiotics na ako para hindi ako magkasakit. Diba? Minsan gano'n, it's a left and right thing. I don't know where it started, but a lot of people keep their old prescriptions, and then instead of like calling their doctors, they just self-medicate with the previous antibiotics their doctors gave. And so minsan, it's not the right type of antibiotics now. So because of that, you're destroying the whole flora everywhere, especially in the
Mm-hmm.
bladder. So you're now making yourself more prone to infections in general, but more of UTI
Actually,
talaga. Mm.
Doc, akala ko when you were saying self-medicate, the like when people say you can use cranberry juice for UTI,
Oh
I thought it
no!
was like something like that, self-medicate.
When I say self-medication, it's when we doctors say self-medication, we don't like it. It's yung antibiotics, diba? This is like parang
Mm-hmm.
very not a smart way of using antibiotics. Kasi people have realized that there are certain antibiotics for certain diseases, and there are ways to take it. There are different dosages. So, pag mali ang gamit mo, mali ang ilang araw mong tinake, that will actually, create a havoc in your body. So, tapos, alam mo, kung din sa mga UTI, yung mga may diabetes. Yun,
Mm.
diba? Oo. So yun, or yung may mga history na nagkaroon ng kidney stones, tapos yung mga hindi umiinom ng tubig, yun, those are the, because you don't like drinking water, you're not well hydrated, and so the body has a negative water balance, and whatever fluid you have in the bladder is actually concentrated, and it's a very good medium for bacterial growth.
Oh, okay. So Doc, when you have UTI, for example, you shouldn't be taking your own antibiotics then. It should be really
No.
ideal that you go to your own doctor. What about on the opposite side, Doc, where
Yes.
you don't want to take antibiotics? Does that make you more or less prone to UTIs in the future?
Um, because the antibiotics are created basically to solve problems like infections and stuff. Now, if you really don't want to take the antibiotics, fine, okay lang yun. That will actually decrease your chances of developing UTI because of misuse of antibiotics. However,
Oh.
there might there may be cases wherein you really need to be treated, and then if you're not taking antibiotics, your body will on its own try to combat the bacteria, but pwede kasing it cannot totally eradicate. So the bacteria is just there. It's stagnant there, and then when your
Mm.
immune system goes down again, yun na naman, magkakaroon ka na naman ng symptoms ng UTI. Kasi hindi siya natatanggal.
Okay. So it's either
Mm-mm.
parang dalawang extremes, no? Either you're overusing the antibiotics or you don't use it and then my risk of sepsis.
Yes. Or you're not using it. Oh, yes. Oo,
Okay.
parang gano'n, no? Yeah, you can put it that way, yeah, oo.
Okay, so I think that you know what you're saying, Doc, is just go to your doctor. Always go to your doctor.
Exactly. Tapos ngayon nga, ang dali na kasi pwede ka mag-telemedicine, eh. Diba, you can always call your
Mm.
doctor if you have a best friend already, a doctor. By this time, I think siguro na naka-establish tayo ng relationship at one point in time with one doctor, with whether he be an internist, an obstetrician gynecologist, or whatever specialty, you have a trusted doctor that go-to doctor mo yun eh. Any illness. Kasi ako yung mga ganun akong patients eh. I'm an OBGYN, but they ask me for anything and everything eh. Diba? So, there. So, pwede naman ganun. You can just ask and parang ask for guidance.
Mm-hmm. Now, Doc, I'm looking at the uh, risk factors here on the slide, and then I'm very curious about yung
Yeah.
immobility for a long time. Bakit risk factor ba ito yung immobility?
I think it's really more for those who are sick for a long period of time and then they don't really pee on their own. So it's me or hirap sila mag-pee on their own. So nakakatheter sila or what do you call this?
Oh.
Parang yung mga ganon. So these are siguro that's how I interpret it, diba? Na nakahiga na lang sila, may sakit. So they're not the fluids are not moving in their body as much as it should be. So now again, negative water balance, so you're more prone to UTI.
Oh, okay. So, hindi naman siya
Parang
meaning,
lahat
Doc,
eh.
like, if I have,
Mm.
oo naman. So, hindi na siya like, if I have an office job and I'm just sitting in the chair all day, immobile, that, I'm more prone to UTI than a
You're,
job where I'm working, moving around.
okay, you're more prone to UTI if you stay in your seat even if you really have to pee already and you hold it in. Kasi you have to do ito yung naging problem ng mga BPOs eh, diba? Kasi sa kanila every minute counts. So they're glued to their computer, diba? Right? I'm sure you have friends. They're glued to their computer and they can't just leave it. So they basically have what they call bathroom breaks. So, I mean, kahit they really want to pee ready, they have to hold it in until the designated bathroom break comes. So, now that's why people from the BPO are actually more also prone to develop UTI because of this. Kasi they hold it in eh, diba? There.
Oh, okay. So even yung lifestyle factors nyo will really affect the likelihood of UTI. Not even just medical conditions or like diabetes and pregnancy, but just
Yeah,
being in a
so,
BPO, for example, may higher risk siya.
oo. Mm-mm.
So so thanks for that talk. So if I suspect na may UTI ako, how will I go about the diagnosis of it? What test will my doctor run?
Okay, the most common is actually a urinalysis. So from there, we can actually already check if you have infection. So we check for the WBC, we check for what do you call this, the presence of bacteria, and then we can also like through the urinalysis, we can also see if you're passing out sugar, kung diabetic ka, diba? If you are actually if you have stones, pwede kasi may mga crystals siya. So pwede rin that will explain sometimes na parang symptoms na parang UTI-like. So the urine test can actually tell us a lot already. So this is the basic test, the first line test that we do. Now, if say for example, despite the fact that we've done a urine test and then we've given treatment and the patient is still symptomatic, then we may request for other procedures like you or the ultrasound of the kidneys, ureter, and bladder just to check if there are stones or there are strictures or whatever problem is happening from the kidneys to the ureter to the bladder to the urethra. So, pero ang pinaka-common is urinalysis.
Mm-hmm. So, Doc, is it often when you're diagnosing a UTI case that it escalates na dapat may another level of testing like the ultrasound, or that's a rare case lang, Doc?
Hindi naman siya actually very common na siya eh. There are patients now nga kasi na because of the improper use of antibiotics, minsan nagkakaroon ng resistance. So, we request for urine culture, and we request for an ultrasound there. Tapos, very important, Luisa, is how we collect the urine. It's a make or break thing, diba? When you undergo a urinalysis, the right way of collecting urine is to pee a little first, and then collect ka. Tapos bago matapos, you remove the cup. So, yung mid-flow stream lang ang kin-catch natin. Don't catch everything. Kasi if you catch everything, chances are, talagang medyo, meron kaming makikita. May makikita kami there. So, the midstream urine, yun ang kinakatch natin. So, very important that you have to know how to collect your urine.
Right. So, Doc, my questions here, for example, we have one from Gian Valentona who says, "Hi, Doc and Luisa. Will wearing tight clothes cause UTI?"
Okay, tight clothes technically will not. You're more prone to actually now vaginitis, fungal infection. That may, if you don't treat it, may actually affect, again, kasi by anatomy, urethra is in front, vagina is in the middle, the anus is at the back. So, any infection in any of the three, hawa-hawa lang yun. Okay, so but tight clothes in general will not make you directly have UTI. Thanks for the question.
Thank you. So, we have another question. Doc, if you may.
Ano po ang cause? How do you pronounce? Ang ganda naman ng pangalan nito. Rev G. Okay. Ano po yung cause ng paulit-ulit na UTI? Rev G, pag hindi nagamot ng maayos, okay, or merong other causes aside from infection, like you may have stones, okay, or merong kang diabetes, yun, madalas, or parang poor ang hygiene. Pag kunyari, ang feminine wash na ginagamit mo, hindi siya akmasyo, or what do you call this, it removes all the normal flora that is protecting you, mas prone ka to infections there. So, Doc, can you drink cranberry juice?
Okay.
Can drinking cranberry juice? Yes, of course. Yes, cranberry has been known to have antibacterial properties and it actually helps with pain, UTI. So, it can actually help. But there is one supplement that's better than cranberry, actually.
Well, we'll talk about that. So, Doc, actually, before we get into, things that can help prevent UTI, can things like soft drinks cause it? So my question here from Jovi Saspa, who says soft drinks po ba can cause UTI? Is that true, Doc?
Okay. Soft drinks in general does not cause UTI. It's you not drinking water and just always drinking soft drinks. It's what's going to make you actually develop UTI. So, You can drink your soft drinks, but then make sure you also drink your water. At least especially now it's very hot, diba? So mga 2 to 3 liters a
Mhm.
day of water. That's not including the soft drinks, the juice, the coffee that you drink. Especially when you drink coffee, actually, you become dehydrated. You pee more, diba? Luisa, I don't, do you drink coffee? You drink
Actually, I'm
coffee
not a
ba?
coffee drinker, Doc,
Okay,
so
that's good. That's good.
I'm not
Ako din,
there.
hindi na rin ako masyadong nag-coffee ngayon. But I think people drink coffee notice that when they drink coffee, they urinate more often. Eh. So, dapat yun, you replace it with water para you're less prone to developing possible UTI.
Right. So, Doc, when you were saying that if I don't urinate, then I can increase my chance of getting UTI. Pero if I'm urinating a lot from the coffee, I also increase my chances of getting UTI. So,
No, no, no.
what is
It's
the...
no. Okay, 'di ba weird na. No, ang ibig sabihin lang ng when you drink coffee kasi it's a diuretic. So you pee a lot. Okay, which is good,
Mhm.
'di ba? Kasi you're cleansing yourself. Kaya if you don't replace the fluid that you excrete, eh di nawawalan na ng
Mhm.
fluid inside, 'di ba? So ang message ko lang dun is if you're drinking coffee and you're peeing a lot, drink a lot also to replace whatever. Basta ang hard and fast rule dyan, every time you urinate, replace 1 glass of water. Yun lang yan.
Okay, I think
Hmm.
it's a very good rule. Everyone's going to be drinking water na, Doc.
Yes, oo.
So we have another question here from Neb Nodge who says, what is the best drink for UTI, cranberry or buko juice?
Both are okay. Both are okay naman.
Oh, okay.
Different
So
ang
hindi
ano
naman
niya.
siya like, okay, what are the
Which one is
differences
better?
with cranberry juice?
Best rin is water. Water pa rin, more than anything. Okay, buko juice basically kumbaga it cleanses you. Okay, ang
Mhm.
cranberry, it has some antibacterial properties that helps one with the pain. So, mag-iba yung mechanism of action niya, ang effect niya. Pero ang pinaka-best, if you ask, it's still water. Water siya.
Mhm. Okay. So Doc, while we're taking all of these like juices and stuff, what is the actual best treatment that doctors recommend?
Alright, okay. Initially, if it's just mild UTI, ako personally, we try water therapy first. But
Mhm.
kung for example, if a couple of days ganun pa rin, may symptoms pa rin, then we give antibiotics. Okay? We give antibiotics. The most common that we give and is also safe for pregnant women is cefuroxime. So there, you take it twice a day for 7 days, and antibiotics technically. But yun nga, sinasabi ko sa inyo yung na antibiotics, but it doesn't mean that you can now take it because it's coming from me and I'm a doctor. Diba? So, maganda pa rin na everything is based on the results of the urine test. Kasi, we look at the urine test. If the WBC is less than 5, kasi the normal is 0 to 2. Okay? But
Mhm.
there will be, we count na 2 to 5. Pag 2 to 5, usually hindi pa kami nagtitreat nun eh. Water therapy lang talaga.
Mm.
Pag it's beyond 5, then we start you on antibiotics. So, depende rin talaga sa urinalysis plus some other things that we look for in the urine.
Mhm. So, Doc, sa water therapy nyo, how much water do you typically expect patients to be drinking during this time? And then, can I add? If I'm drinking also cranberry juice or buko juice, do I have to drink extra water pa on top of that?
Yes, recommended water intake now, especially now that it's very, very hot, is about 2 to 3 liters of water a day. That's excluding all other fluids that take in. So, lang siya, 2 to 3 liters of water a day.
Oh, okay. So, yung water therapy is really just what's the recommended water daily. Hindi
Yes.
naman siya meaning extra water.
No, 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 no.
Okay. And so, Doc, will water therapy prevent UTI? What are some ways to prevent it?
air. Drinking ample amount of water will actually decrease your chances of what you call this getting UTI. Yung cranberry juice can actually help. When as for women, it's there. So nasa slide natin. For women, it's proper hygiene. So when you wipe, di ba, when we go to the washroom or we go to the restroom, tapos when we're outside, although we're lucky now kasi it's pandemic, so sa bahay lang. Kung nasa bahay lang, do not wash naman every time you pee or every time you go to the bathroom. Kasi pag masyado ka namang malinis, you're removing even the normal bacteria. However, if you're outside or you're just wiping with tissue, the recommended direction is from front to back. Okay? Front to back kasi para hindi ka magdala ng bacteria from the anus going to the urethra. So, it's front to back. Tapos, the next advice I can give is as soon as you feel like you wanna pee, you actually, urinate, diba? Don't hold your pee. Tapos, fourth ko ba to? Fourth or fifth? If you have sexual intercourse, o kaya you have a partner, or you have a husband, you have sexual intercourse, and if you're not naman planning to have a baby, after intercourse, try to drink water and then try to urinate. Tapos yung in terms of feminine products, try to be very discerning. Make sure that you don't use feminine products that have a lot of what do you call this, yung mga may mga scents. Yun. So, mas maganda yung very mild and that it will promote actually the acidic pH of the vagina. Tapos, if you're using either diaphragm, condom, or spermicides, if you can actually decrease the usage to decrease the chances of possible infections, this can actually also help.
Okay. All right. Thank you, Doc. And then what about daily lifestyle? Is there anything I can take, as you were saying, for example, cranberry juice or buko juice? Are there things foods that prevent UTI?
Okay. Okay, very, very important for any infection in general, Luisa, is that you have a very good immune system. Okay, so I usually advise my patients to make sure that their immune system is in top shape. And how do you do this? By taking your vitamins and taking supplements that are actually, promote a healthy immune system. So it contains a lot of vitamins, nutrients, amino acids that will actually help the body maintain its balance. Kasi pag healthy ang body mo, lesser ang chance that it will succumb to whether it's a bacterial infection or a viral infection. So this advice technically is not just for UTI, it's for everything, especially now that we have COVID. So yun, immune system is improving your immune system, making sure that you invest in your immune system. Yun ang pinaka-gift mo sa sarili mo, Luisa eh. Ako yun ang sinasabi ko sa patients ko, mas okay na, diba, na you take supplements and you're not kaysa, alam mo, you're not taking anything, okay naman ako, I'm healthy, tapos biglang gagastos for antibiotics and all those things. Sana hindi ka hospitalized, pero paano kung ma-hospitalize ka pa, diba? Oo.
I agree, Doc. Health is wealth.
Yes, exactly. Health is wealth. Para hindi rin consult ng consult.
Yeah, exactly. And then it's very important we take these preventative measures, Doc. Kasi I know COVID is still an issue in Manila. The cases are still very, very high, no, sa NCR.
Yes, exactly.
That you don't really want to be going to hospital or visiting a doctor.
Exactly. Exactly, diba? So, yun eh, invest in your immune system. And so, how to do this? Take your vitamins and your supplements. And then, be also very smart in choosing the right supplement that will, work holistically na. Kumbaga, hindi siya yung pang skin lang or pang heart lang or pang ano lang. Take something that will actually target everything already.
Okay. All right. Thank you, Doc. So that brings us to the end of our discussion now for UTI. I think we actually covered a lot of question and answers for this. But if there's anything that you want to add, Doc, any takeaways, what are they?
Okay. UTI is a very common problem, and then everyone is at risk. So the best way to fight it is how to prevent, and that's by drinking a lot of
Mhm.
water, 2 to 3 liters a day, practicing good hygiene, and making sure that your immune system is in tip-top shape.
Okay. Thank you, Doc. I agree.
Thank
Prevention
you.
is way better than cure almost
Yeah,
any day.
exactly, exactly.
Okay. Well, I hope to see you again soon, Doc. And
Yes.
to
Oh,
your
I love
nurses.
that.
Oh, I'd love that too. And to your nurses, Doc, happy Nurses Day to them.
Oh, happiness day. Yes.
And diba, happy Nurses Day. I just remembered actually.
And then
But
dated Happy Mother's Day to everybody. To all the
oh
moms who
yes,
are
but
watching.
I know, I'm sure you've had a lot of people to greet Doc as belated Mother's Day.
Yes.
Okay, thank you so again so much for coming, Doc Mitch.
Thank you. Thank you. Thank you for having me.
All right, so that was our episode on UTI. I hope you guys all enjoyed my questions. Ba kayo? Like anything that you haven't had answered, please ask them in the comment section below so that baka yung next topic or next UTI episode, we can talk about it. And then so what are your takeaways also if you don't have any questions? Ako din, like my takeaways are really prevention is better than cure. And it's really good to just do the preventative measures like drinking a lot of water, taking supplements, and taking care of your whole body. Kasi kung may condition ka, for example, diabetes or kidney stones, mas prone ka to UTI. So I think that's a great way to prevent it. So that being said, let us move on to our Olani. So while we were talking about food supplements, like we said, health is wealth, and we invite you to try our Organique Acai products. Here's the Olani. Now, if you already have the Organique Acai products and you tried it, you loved it, we invite you to become one of our official resellers here at Olani PH here on Facebook. Share the health, spread the wealth. If you love it, spread it. Share it to your close family and friends. You can also check us out, our products here down below. You'll see that little banner where we are available, Mercury, Watson, South Star, and all of the other places. So we're also having a promo right now for the month of May. You can check us out on our website. Our website, we're 15% off selected items with free shipping nationwide. So if wala ba kayong chance to try out our products because you're not too sure if you want to make the commitment, now is the perfect time for you. And then that brings us to our game. So yung winners namin, okay, did you actually guess it correctly? Did you get it correctly? I saw a lot of people comment 11 Organique Acai freeze-dried bottles, and you are correct. There's 11. So to the winners, congrats to you. And the winners, dun, 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 drum roll. The winners of today's gift pack are Sabrina Gapan, Bianca Ting Jose, Marie Torrefranca del Valle, Monica Almeida Perez, and RX Diaz. Congratulations to you. So our team will be contacting you as to getting the details of your Organique Acai gift packs. Now, that brings us to the end of today's episode officially. And I know that Ramadan is ending for our Muslim family and friends. So I just want to greet you all advanced, let me pronounce this right, Eid al-Fitr. Hopefully I pronounced that right. And happy celebration. I hope you guys can all feast soon. So take care and I'll see you next week.
Wellness Wednesdays with Organique. We care because you matter.